Hello everyone, welcome to my channel. Today I'm going to talk about iron deficiency anemia. Starting with the definition of the anemia, I'm sure most of you know that anemia is decreased oxygen carrying capacity due to reduced red blood cell mass, and there are different types of anemia, but the most common one is iron deficiency anemia. And the reason there will be anemia because oxygen binds to the hemoglobin to be carried to different parts of the body, and oxygen specifically binds to the iron part of the hemoglobin. Hence, there will be anemia whenever there is deficiency of iron. At first, it's very important to understand about iron absorption. There is heme iron, which is present as ferrous form, which is Fe plus 2 in the meat products, and there is non-heme iron, which is present as Fe plus 3, which is found in plant-based food. The heme iron enters the enterocyte via heme iron transporter, which is the yellow one, to the cytoplasm, and the non-heme iron cannot enter enterocyte because it is in its ferric form. In order to enter the enterocyte, it has to convert it into the ferrous form, and that is done by the iron reductase, which is the blue circle one at the apical membrane, and then it enters the cell via the DMT1, which you can find it, which is next to the blue circle. Now the iron from the cytoplasm leaves via ferroprotein 1, which is the purple one, and then the ferrous form is converted to the ferric form, and that is because then the iron is carried to different parts of the body via a protein which is called plasma transferrin, which is the blue one. And the plasma transferrin only binds to the iron when it is in its ferric form. And also one important thing you have to remember is that iron regulation only happens at the absorption level. For example, whenever there is increased serum iron level, the liver will produce a protein which is called hepcidin. Hepcidin will bind to the ferroprotein 1, hence there will be no iron absorption, and the opposite happens when there is low serum iron, such as in iron deficiency anemia. The liver will not produce hepcidin, therefore hepcidin will not bind to the ferroprotein, so there will be iron absorption. There are other cases in which the liver produces more hepcidin, such as in systemic inflammation. So, when there is iron deficiency, the bone marrow cannot produce hemoglobin normally. Hence, the red blood cell in the iron deficiency anemia will look less red comparing to normal blood cell, and they will also look smaller, or they will also be smaller. That's why we can also call iron deficiency anemia as microcystic hypochromic anemia. Microcystic meaning smaller, hypochromic meaning less in color. There are three main causes of iron deficiency anemia. First, decreased supply is when you have less iron in your diet. Second, increased demand, such as the case in pregnancy. Third, blood loss, such as bleeding ulcer, celiac disease, having infrequent menstruation cycle. As for the symptoms, there are symptoms which are common to all types of anemia, such as weakness, and there are symptoms which are specific to iron deficiency anemia, such as spooning of the finger. Second, pica, which is eating non-food stuff such as dirt. Third, Palmer-Vincent syndrome, in which you can see iron deficiency anemia, dysphagia, and the esophageal wave, which is seen in the bottom picture. Diagnosis: there will be low serum iron. I wrote ION instead of iron, and there will be low transferrin saturation. There will be increased iron binding capacity, and of course, the red blood cell will look smaller and less red in color. As for the medications used for iron deficiency anemia, I will not talk about it in this video. Maybe I will make a video in the future after when I upload video about the other types of anemia. Thank you for watching. Please like and subscribe, and also comment what topics do you want me to make videos about. Once again, thank you.